Addiction remains a significant public health crisis in North America and many places globally. Addiction can feel scary to handle, and as therapists, it can feel even scarier for us to treat. What can compound our confusion is being constantly bombarded with new programs and new methods that are out there promising a quick fix for the treatment of addiction. Yet so much of what got those of us who struggle with addiction in trouble in the first place is this pursuit of some kind of quick fix or instant gratification. You may hear conflicting messages like, no, the 12 steps are outdated. They don't have any kind of use in healing anymore. Or a lot of folks coming to you may genuinely still find the 12 steps helpful and supportive. How do we navigate through all of this? And may the best answer for helping others to heal from addiction and behavioral compulsivity be to embrace more of an all-of-the-above approach. I'm Dr. Jamie Marich, a licensed professional clinical counselor, registered expressive arts therapist, and registered yoga teacher based in the state of Ohio. I've had a lot of experience as a professional clinician working at various levels of addiction treatment, inpatient, outpatient, community dual diagnosis programs. I'm the author of the book Trauma in the 12 Steps, which was originally published in 2012 and reissued in 2020, and the author of several other books and workbooks in the field of trauma recovery, dissociation studies, and expressive arts. I'm the founder and director of the Institute for Creative Mindfulness, which is a training program primarily centered in EMDR therapy. So that is the professional side of my credentials. Personally, I'd like to introduce myself to you as Jamie. As we might say in 12-step recovery, I'm Jamie and I'm an alcoholic. Or an identifier I've been using a lot more lately is I'm Jamie. I'm a person in long-term recovery. Now, I'm someone who benefited significantly from the 12 steps in my own life. My first recovery sponsor or mentor, Janet Leff, brought me the steps in a way that I would now describe as very trauma-informed. And when I started really doing this trauma and the 12 steps work over a decade ago, an early interviewer asked me, what are you hoping to get out of this by promoting that bridging the worlds between 12-step recovery and trauma recovery can be possible? And my simple answer is this: I would hope that anybody seeking help, like I was over 20 years ago, could have an experience like I had with Janet. She showed me what the 12 steps could offer me, yet was gentle, kind, and trauma-informed in the process. And in some of the little teachings I'll be giving you here and some insights, I hope to impart some of that gift that Janet gave to me. I met Janet in 2001 when we were working together in humanitarian aid in Bosnia-Herzegovina. I had the great privilege of being mentored by her in the steps in this rich, trauma-informed way. And then when I moved back to the United States for my graduate studies, I was a little disoriented because I saw that not everyone practiced the 12 steps in the same way that she did. And I was further disoriented when my master's degree program then transitioned into me pursuing a PhD. And I saw just how much hate there was for the 12 steps. That yes, there was still some lip service given to. The 12 steps have been a helpful part of the history of treatment and how it's developed in the United States, but they really are antiquated. They're overly religious, they're out of date. And so, motivated by my own confusion, I decided to dig deep and explore the various recovery programs that were available at that time in the early 2000s. I looked at programs like the 12 steps and their historical backgrounds. I looked at alternative programs like Smart Recovery, Rational Recovery, Women in Sobriety, Men in Sobriety, and I was really trying to find what the common denominator was between all of them. And what I arrived at was this issue of lifestyle change, that any real solid recovery program seems to facilitate lifestyle change in the individual who is seeking recovery, however they may define it. It made a good deal of sense to me at that point. Why don't we take a more all-of-the-above approach in working with our folks to truly meet them where they're at? So when I started pursuing more advanced training in trauma modalities and attending trauma conferences, I was surprised and even a little saddened to learn how many people in trauma therapy world didn't like this all of the above approach. They seemed to expect that in order to be taken seriously as a trauma therapist, I should outright reject the principles of 12-step recovery. And this just never made a lot of sense to me, especially as somebody who benefited so much. So around 2010 is when I started teaching more actively on trauma-informed addiction care. And during one of the talks I gave, I remember I was specifically in Minneapolis, Minnesota, and a few folks came up to me after the course who themselves were individuals in long-term recovery and worked in a treatment center. And they said, Jamie, you're doing such a good job of really showing how both can be valuable, how what we're learning about trauma-informed and trauma-focused care is valuable, and how we don't have to throw the proverbial baby out with the bathwater with 12-step recovery. And as individuals who benefited from the 12 steps and still saw their value, they really just highlighted, you seem to be a very good bridge with this work. And those comments from some folks who are now friends are what gave me the initial inspiration to write the book, Trauma and the 12 Steps. It's been very inspirational for me to see whole recovery systems, treatment centers, recovery housing agencies get copies of Trauma and the 12 Steps and distribute it to their staff saying, just read this because there's some simple ideas in this book that just may help how we language some things. And this will help us to make a difference in honoring the struggle of the people that we serve. And finally, and perhaps most importantly, I've been impressed by having people I just know in the recovery community who have connected with this work, people who aren't necessarily my clients, say, after connecting with some of the ideas in Trauma and the 12 Steps, I know that we need to get our own trauma therapist now. And this is something that I wouldn't have even imagined 20 years ago when I first came in, seeing so many people in recovery fellowships out there in the community talk about the need for trauma-informed care. I teach throughout my work that the key to trauma-informing anything is a willingness to modify language. And indeed, some of the strongest criticisms that I've heard about 12-step recovery from trauma professionals is that the language of the 12 steps are outdated. And my response to that is you're right. The 12 steps were originally penned by two cisgender white men, upper middle class, in the 1930s. So a technique that I use a lot with folks when they approach the 12 steps, and we're going to do 2 sample steps here with this, is how can we change the original language of the step into language that will work for us more effectively now in the present day, perhaps as a person who's activated by some of those original terms. So one of the criticisms that we hear is step 1 itself. We admitted we were powerless over alcohol and that our lives had become unmanageable. And so when I'm sitting down with a client, I'll say, let's just kind of look at where the points of activation are in this step for you. What words are the problem? And then I try to go into some of the just discussions about how we can pick apart each word. So let's start with we, even that pronoun. We admitted we were powerless over alcohol. It is not an I. It's not saying I am powerless. I am a powerless person. Rather, we, meaning the collective we, the fellowship, that there have been others who have survived the shipwreck of addiction with us. And I also would challenge you to consider how that word powerless, what that may do for you even in your body right now. The step is not saying I am a powerless person. And that's how a lot of individuals in the trauma therapy field see or read the step. It is saying we are powerless over alcohol. So what that means for me is if I put alcohol in my body, it's very likely that the alcohol is going to win. And there's really a lot of Eastern wisdom in this idea as well, that by admitting where I am struggling, that by admitting where I just need to surrender and let it go, we can actually step in to a great deal of power. So another thing you could do more somatically is to encourage your folks, and you can try this right now, to even move the hands a little bit back and forth between power and powerless. Power and powerless. Let me try that along with me. And ask, how can I actually gain or step into my empowerment as my true self when I could admit to those things that may trip me up? Another language criticism is step 6. We're entirely ready to have God remove all these defects of character. So first things first, and even the steps themselves acknowledge you do not have to use the language of God. It could be higher power, inner power. I have a lot more ideas that I often pass on this, but I want to focus in first on this phrase, character defects. And even as I say character defects, notice what that may bring up for you. I don't like it, even as somebody who's an adherent of the 12 steps, because it can tap into this trauma-based cognition that I am defective. I am defective. So change up the language. A language modification that is actually used in the program of Workaholics Anonymous is negative coping skills. We're entirely ready to have our inner power remove these negative coping skills. Remove these behaviors that no longer serve us. And even as I share these language modifications, just maybe notice the difference that you feel in your body and how you can translate some of this spirit of modifying and changing language to your work with clients, regardless of which condition you're treating. If you'd like to learn how to be a more effective bridge as a clinical professional, linking the wisdom and knowledge of 12-step recovery and the early foundations of our field, together with what we have learned about trauma, trauma therapy, and trauma healing, I'd like to invite you to my course, Trauma, Addiction, and the 12 Steps, sponsored by Academy of Therapy Wisdom. This course will take you through 4 modules of content. In the first module, we'll go into more detail about exploring and better understanding why unhealed trauma is a factor in the development of addiction. And yes, we will even take on this issue that the word addiction may not be the best, most resonant word for many of your clients in the modern era. But remember, in the spirit of there's always a modification, this is okay. And we will take this attitude of growth and embracing an all of the above approach into this first module. In the second module, we'll give you more of a 12-step recovery overview, maybe review for some of you, but particularly if you're coming at this content as a mental health therapist, as a trauma therapist, we will fill in some of the gaps that you might have in knowledge about what the 12 steps are, what they can offer, and yes, where the application of the steps can be problematic. In the third module, we'll be endeavoring towards a solution, looking at where our knowledge of trauma and trauma therapy can help us better adapt and modify the 12 steps. We'll give you some solutions for how to work with your clients who are perhaps seeking 12-step support in the community, and maybe even considering how you can introduce integration of 12-step meetings into the clinical process. This module, again, is all about solution, and we'll be looking at many different ideas. And in the fourth and final module, we'll be exploring one of the core teachings of Bill Wilson, a co-founder of AA, who admitted that outside help may be needed. Not even he, as a co-founder, ever asserted that the 12 steps were the be-all and end-all for solving the problem of alcoholism or addiction. In this module, we'll be specifically exploring how mindfulness-informed interventions, which are likely strategies that you as therapists may already have some training in, how we can enhance those to support people who are on a recovery journey together with the use of 12-step principles. So my friends, I hope that what I shared today was helpful, especially helpful in allowing you to consider that all of the above is typically more beneficial than a quick fix approach, particularly when we are considering the perils of addiction that may show up in our offices. One of my early bosses loved to say, it is so important that we honor the struggle of the people that we serve. And if you are that kind of therapist who knows that you have a heart for honoring people and where they are coming from, we hope that you consider joining us for this course. When I got sober over 20 years ago, Janet, my mentor and sponsor, offered me the piece of guidance that would change my life. She said, Jamie, after everything you've been through, having heard some of my trauma history, it's no wonder that you became an alcoholic, that you became addicted. What are you going to do with it now? That guidance has not only shaped my life, it has shaped how I work clinically. That yes, it is important to honor the struggle and meet people where they're at and offer them some promise of action, some promise of solution, some promise that yes, there is something we can do about this. So let's take this action together. My friends, that is my invitation to you. Let's continue to take some action together. And if this calls to you, I hope to see you in our course.